Hey everyone, welcome back. Let's discuss red light therapy. Clearly a promising wellness tool. In fact, the most recent, I think, compelling data point here reviewed 204 randomized control trials and found consistent benefit across hair growth, pain reduction, cognitive function, oral health, and wound healing. Now, one of the challenges is in the marketplace with the interest, there's now many devices, there's competing marketing claims. Some devices I feel are vastly overpriced. So I wanted to take today as an opportunity to share what I've personally researched and used, the specific devices, what my results were, and what I learned. So let's jump in. And if you're new here, welcome. I'm Michael Ruscio. I'm a doctor in private practice, an adjunct professor, and I also work as a clinical researcher with a few papers published in scientific journals and more in the works. Okay, so let's start with the panel application of red light. There's all different devices. There's hair devices, there's devices for your gums, and I have a number of them here, and we'll kind of walk through them. But if we're going to be using one device that will maximize your return on investment, meaning treatment time in leads to the maximum therapeutic benefit out, that's where we want to target a device like a panel or a total body treatment that's going to hit the largest area. So the device that I've used is the Platinum LED Biomax panel. There's a few reasons for this. It has a wide range of wavelengths. The shorter the wavelength, the more superficial the penetration. The longer the wavelength, the deeper the penetration. So if we have a device that has a range from short to long wavelengths, we get a variety of tissue depths that will hit. So this will really give us, not only with a panel, the broadest area that's covered, but also the greatest level of variance in the depth of tissues that are impacted. A few things here that I should point out regarding why Platinum LED's Biomax I find beneficial and sort of like this total body broad depth application, because we can have improvements for muscle health, joint health, skin health, even one study finding improvements for thyroid health, improvements in sleep, and in fatigue. We're not going to necessarily get that with a small little device that just hits the bicep. So this is why I think if you're going to use one red light device, something that covers a large area is probably the best bet. Now, there's caveats there. If you're trying to improve your gum health or your hair health, then a panel isn't designed to reach those areas. But nevertheless, here's what I noticed. My skin looked better. More often, I would notice I looked as though I had a great night's sleep and was just really refreshed and recovered. My muscle soreness seemed to be less after working out. I wouldn't say I took it down to zero, but I did feel more fully recovered. And sleep, I did notice it was easier for me to fall asleep, and my duration appeared to be improved also. There's a few lessons that I learned that I think are really important. One of the good things and bad things about the panels now being stronger, and Platinum LED's Biomax, amongst others, it's not the only one, but again, it's just the one I used, are higher irradiance, which means the intensity of the light. Now, the pro here is that with the higher intensity, you can achieve a shorter treatment time. That might mean 10 minutes as compared to 30. And if you're doing this a few times per week, then that can have ramifications, obviously, for how much time you're just stuck sitting there in front of a panel. But the all too important con here is these more powerful devices run the risk of overtreatment, or technically speaking, overstimulation of the mitochondria. This is what happened to me. When I started using more and more red light, I started having joint pain. In fact, I had bilateral patellar tendon pain or knee pain. Now, we know why this occurs. It's because with many hormetic stressors, many healthy stressors, exercise would be one, red light would be another, there tends to be a biphasic dose response, meaning some of the stimulus is beneficial, your body adapts and becomes stronger, but there is a point at which the body can no longer adapt, and now you start having a negative effect. That's what you're seeing here. To simplify this, what we want to see is ATP levels and mitochondrial membrane potential, that's the MMP. We want to see these going up, which they do. until this juncture where then they start to crash. So you have a reduction. If you keep the dose escalating, and on the horizontal axis here, this is increasing doses of red light. So what you see is, yes, we're having improvements in ATP, improvements in mitochondrial membrane potential, good. And then they start to tank. And what goes up is this essentially inflammatory component known as reactive oxygen species. This is why it's very important for anyone who's doing red light to understand this concept of the biphasic dose response, which means there's an optimal loading parameter. Too much can be and often will be deleterious, as I learned. Now, there's not only this mechanistic observation, there's also data. This is from a study looking at runners where they administered different doses as joules, 15, 30, or 60 joules. And I'll just quote this paper. The 30 joule dose promoted the highest ergogenic effect or performance enhancing effect in runners, which suggests a typical biphasic dose response. So just don't forget about this. This is even more relevant modern day because we have full body applications like panels, we have localized devices to treat joints, and what can end up happening is people double up, and that can be problematic. So for a panel type device, the usage guidelines, 3 times per week, not 5, not 7, 5 to 15 minutes per session at a distance of roughly 12 inches away. Now, if you go significantly closer, let's say 6 inches, then you want to be closer to that 5-minute treatment time. And let's say you were 18 inches away, you want to be closer to the 15, maybe you can even do 20, because the closer the device is, the more intense, and therefore the shorter the treatment time. I share this because there's no magic parameters. It's just simple math. The higher the irradiance and the closer it is, the more you're exposed to, the more mitochondrial stimulation that you'll have, which means a shorter amount of treatment will hit the optimal dose. The weaker the light or the lower the irradiance and the further away you are, the less stimulation, the longer the treatment duration can be. A few other thoughts here on kind of the more total body application. There are now these emerging sort of sleeping bag devices that I think have some merit. They're not as powerful and they typically don't have the same dispersal of wavelengths. But I think if you're looking for a cheaper entry point option, those are fine. There are other panel devices out there that I think are adequate other than Platinum LED's line. Mito Red Light is also one that we've looked at and I think is pretty similar. So there are options. This is what I've used. And I think the most important thing is just to avoid the overusage. And by the way, this is helpful. Please like, comment, or subscribe. This will help other people who are trying to understand how to use red light find this video and hopefully prevent them from some of the pitfalls that, I stepped into. Okay, so the next application, this is where it is important not to double up, would be the Kinneon Move and the Nova pad. This pad, as you can see, is designed to go around the knee. They also have pads that are more like a heating pad, sort of rectangular shaped. And I don't have the Kinneon Move here, but I've used both of these. So there's pros and cons to each. Taking a step back, with an application of trying to treat a joint specifically, it's better to have a device that has focused light, or what's known as collimation. Collimation is just the ability of the light to stay focused, which is relevant because with something like a panel, as soon as that light leaves the panel lights, it starts to diffuse, which again, if we're trying to get a broad coverage is a good thing. But if we're trying to get deeper into a tissue or focus on one area, this is when the collimation or the focusing of the light becomes beneficial. Now, one of the ways that we can achieve this is by having the device go in direct contact with the skin, right? And this is for the knee, but I'll put it on my elbow. So you're going to have less dispersal, and this is going to allow better penetration into the joint tissue. But here is the thing that you want to be careful of. Is I would not use both something like a total body panel and a joint device. The way that you can do both, if let's say you're trying to do what I've tried to do and failed at times but learned, which is have this sort of overall body anti-aging performance effect. But if you also have a problematic joint, what you can do while you're doing the total body bed application or panel application, cover with a towel the joint in question. So let's say it's your right knee. While you're doing the total body, cover your right knee so you preserve that treatment area to come back to it with a localized device. Now, you don't have to do that, but if you're really trying to get the maximum therapeutic effect for a joint in particular, this is what I think is the only way to sort of double up, so to speak, and not overtreat, because this is exactly what happened to me, where I was doing the bed. I started using a localized application for my knee, and actually my knee got swollen. It was kind of wild. And at first I thought, oh, maybe this is a healing response. No, it only got worse. Coming back to the devices, I do think there's merit to either one of these applications. If you have a knee or an elbow issue, I think this pad from Nova makes a lot of sense. Kineon Move is a slightly different application where it's not going to cover, and I'll show a visual of this, it's not going to cover as large of an area, but if you have more pinpoint pain, then the Kineon Move might be a better option. We can make a case for either one. I think in this case, it's just more what's going to be applicable to your needs. With the Kineon Move, for example, the strap around sort of application I found was easier to target the low back, like the sacroiliac joint. Not so much for the knee. For the knee, it just felt like I couldn't get it where I wanted it. So think about where you have pain or dysfunction, look at these different form factors, and remember not to double up if you're already using another type of more global application red light. And the parameters here with these localized joint applications, 3 to 5 times per week, 5 to 10 minutes per joint. And again, remember, do not double treat. And regarding cost, the Nova Light pad is around $280 and the Kineon Move is about $420. One area where you don't have to necessarily worry about over-treatment, let's say if you're using some type of total body panel, is with hair. Because presumably most people aren't doing a total body panel with their head pointed straight down, right? So the panels aren't designed to hit the scalp effectively. So there's a few different options there. From an evidence perspective, there is ample scientific research showing that red light can improve hair growth. The form factor, I think, and I've learned personally, has been important. So I started with this device. This is the HairMax laser comb. This has an impressive amount of clinical trials demonstrating its effects. It's also affordable at $220. The unfortunate thing is that you have to hold this where you're going to treat yourself, and then you move it 1/4 of an inch every time it beeps like that. And to do your entire scalp, it takes about 11 minutes. And so as you can imagine, this gets old really fast. I'm grateful that we have the technology, and I think it clearly helped me, but I somewhat quickly graduated to the other device that they have. And by the way, these are not the only devices on the market that have been shown beneficial. These are, again, what I've researched, fact-checked the specs, and used personally. The form factor of their laser band I found to be much more, way more friendly to use. The way this works is you hold it on a position in the scalp for 30 seconds, and then you move it back. And as you can see from the size of this, it may only take you, depending on if you're doing, let's say, one in the front and one in the back, 60 seconds to do your entire head. Now, what I do is I kind of offset it because I have some thinning on the sides here. So I kind of offset it. I do one treatment, a second treatment, a third treatment, a fourth treatment, and then one in the back. The whole thing takes 2.5 minutes, and you don't have to be so fastidiously monitoring your movements like you do with this device. There are a couple other caps. If you're looking for the strongest cap on the market, not to say that the strongest means the best, but the strongest one on the market is the Baumann Turbo Laser. Now, ironically, if you have a lot of hair and therefore a lot of blockage of the scalp with the hair, that's where the Baumann device might be the best. It also seems to have the best coverage getting down on the sides, which is one of the other things I did not like about some of the cap devices is if you have thinning here, as I do, then the caps don't really cover this area. So again, the form factor matters. The other two devices I experimented with besides the Baumann turbo laser were the iRestore device and the Capillus. All of these devices have some merit. I think the best bang for your buck and shortest treatment time would be the HairMax laser band, not the comb. So something else I should definitely mention here, which is many hair treatments, as they stimulate the follicle's metabolism, will lead to initial shedding of hairs before the hairs become visibly thicker. This is known as a shift from the telogen to the anagen phase. And so when you shift from a more dormant to a more active or growing phase, you'll actually shed the follicle and then a healthier follicle starts growing in. So this can be desettling. Same thing if someone starts on Rogaine or minoxidil. It's well established that hair shedding starts first and then healthier hairs grow in. And I did notice this. Again, it can be desettling if you're trying to improve your hair and you feel like you're using a device and your hair starts falling out. It's just keeping this longer time horizon in mind is very important. A minimum of 3 to 4 months here to see a noticeable growth. And this is from one research study looking at before and after over a 6-month period. One other thing here I think is very important to mention is, in my opinion, no one hair intervention is going to be a massive game changer. And this is a mistake, not that I necessarily do hair consults, clinically, but in, friends and family members and people at the clinic I discuss this with in a advisory capacity, is people try one treatment and they give it a number of months and they go, maybe I saw something, maybe I didn't, I'm not sure. And so they stop and they try another one. And the real way, again, in my opinion, to approach this is to stack multiple therapies together. Some type of topical treatment, whether it be saw pomato or finasteride, along with a stimulant like minoxidil, along with some oral therapy, which might be oral DHT blockers with nutritional supports like biotin, plus laser or red light. And this will have an effect that's most likely to be noticeable, because there is a difference between what can be found in a research study, which is a significant improvement in hair growth from a statistical perspective, but that can be different than what's clinically meaningful, meaning you look in the mirror and say, yeah, I'm happy with how I look. So just want to put that caveat out there regarding hair devices. These have been documented to be helpful, many of the red light devices out there, but is it going to knock your socks off? Probably not. And so, again, I'd recommend stacking. Let's talk about red light devices for cognition. This is an area that when I learned about the research here, admittedly, at first I was skeptical. And then when I looked at specifically this device, V-Light, and the research that they performed, I was eager to try it. The devices here are designed to penetrate through the skull bone. So these could be used in an overlapping fashion with a hair device. And this is something that we've gotten a lot of questions about. A hair device like this is not designed to get through the cranium and have a cognitive enhancing effect. So, no matter what the hair device, we have all these questions. What about this hair device? What about that? Do any of these help with cognition? The answer is no, right? They're not designed to do so. These are designed to have a superficial and a lower irradiance because they're not trying to get through the scalp. Whereas the V-Light, and I'll show what this looks like here on the screen, this is a high irradiance and it also has a pulsing that is intended to get through the scalp or through the skull, and it has been documented to do so. In fact, V-Light has over 25 published studies demonstrating improvements in Alzheimer's, Parkinson's, traumatic brain injury, autism, and also for boosting cognitive function in otherwise healthy populations. My personal experience here, when I first used the V-Light, I used the product. They have a few different types of helmets in their line. I used the Neuro Duo. It has 2 settings, alpha and gamma. Alpha helps with relaxation. Gamma is stimulating and helps with focus. When I did the alpha, once the treatment session was done, I was so relaxed. I then went and meditated for 20 minutes, maybe even 30, in the middle of a workday, which you will almost never catch me doing. So I was pretty taken aback with that sort of shift in my mood. Conversely, when I started using the gamma setting, it did feel very similar to after having a cup of coffee where you have that energy and focus, but without any of the jitters. So, that to me was so compelling to where I bought their most powerful device because I was so sold from my personal experience, but also because I have a very high value I assign to my cognition, I think like most of us do. So anything that can give me a bump there, totally worth it. One other thing I noticed here, poor sleep is something that has been an issue for me, on and off. And it's probably because I train hard, I work hard, and I tend to be kind of sympathetically wired, which I'm working on. And we're going to have a coming episode about things I found to be helpful there. But because of that, I've noticed that various interventions that touch sleep actually make my sleep worse initially. This happened to me with magnesium threonate, and it also happened to me when I started using the V-Lite helmet. Now, thankfully, I've learned over the years that these transient adjustments shouldn't indicate, this is a general rule. If this happens to you, check in with a healthcare provider or someone knowledgeable about the given therapy. But it's a general rule, if you see a paradoxical response, meaning red light should help you sleep or magnesium should help you sleep, you start using it and you have the opposite effect, that oftentimes is a therapeutic signal that's encouraging, and you just need to lower the dose or lower the application and allow your body some time to adjust, which mine did. And now I can use the device fully without any problems with sleep. Usage guidelines, we covered a few of these. You can use a cognition enhancing helmet device in an overlapping fashion with a hair device. I would start with 5 minutes per day to avoid overstimulation and gradually increase to 20 minutes per day. And these devices can be used 3 to 6 times per week. And like I said a moment ago, V-Lite has a few different models. I'll just put a couple of the examples here on the screen with the different devices and the different costs. There's also a competitor, Neuronic, which I want to amend something I had said in a previous podcast, that there was no published research for their device. And I appreciate the CEO reaching out to us and just voicing the fact that they do have one study for their product. So it's similar but different to V-Lite, showing improvements, I believe, in long COVID, and they found improvements in fatigue and maybe also cognition. So they have one clinical trial and they have more in the works. So as a competitor to V-Lite, not as well researched, but credit to them for getting the one study done, super important, and having more on the way. Another device is called Neuronic, and they're sending one to me now, and I'm going to be curious to try that device and see if I notice any difference next to the V-Lite. But I won't be using both at the same time to avoid that overstimulation. Another device or use case that comes up is these mouth guards. This is, again, that company Nova, and they have a mouth guard device that I think is pretty interesting. I'll show you what this looks like. Yeah, here we go. So you have red light and blue light. Not sure how well you can see that, but it's a combination of red light and blue light. They actually have different methods where it can be all blue, all red, or I think a combination of the red and blue is probably the most advisable. There is a body of research here also showing improvements in receding gum or just gum repair in general, the ability to kill bacteria, improve bad breath, and to gently whiten teeth. Admittedly, even though I have this here, I haven't been very diligent about using it, and it's something I need to try to do a better job with, although it's a pretty easy use case in terms of you can just be sitting on the couch or reading or working and use this. I will share one clinician. So I'm a member of the International Society for Mast Cell Activation Syndrome, and they have an ongoing listserv where clinicians sort of compare notes. And one clinician shared that a patient of hers was having very problematic gum tissue inflammation and was losing teeth. They started using this device, and it had what they described as a miraculous effect. So for a device that's $130 some odd dollars, I think it's certainly worth considering if you have receding gums, any type of periodontal disease, halitosis or bad breath, and use this device daily or on most days for anywhere from, I think the device goes from 5 to 30 minutes per day. I think 10 minutes per day on most days is probably the best target to use. Yeah, that takes us through the devices that I've used. And again, let me just echo that there is a legitimate body of scientific research here. It doesn't mean because that exists, there aren't charlatans and snake oil devices out there, but we should be good about just objectively separating the two and identifying that a well-constructed device is worth experimentation, I think, in many cases. Remember that more is not better. Also, more expensive is not better, and that overuse can occur, so be careful to avoid doubling up on your treatment. And then the one other thing I should mention is for most of these devices, you're not going to see an instantaneous effect. It will take a number of weeks because the underlying mechanism is improving the ability of the mitochondria to produce energy. That takes time to show up in mitochondrial function, cellular energy, cellular function, tissue function. Okay, well, that's a rundown of the devices I've used, some of the results that I've had. I hope this helps, and I hope that if you have questions, comments, or want to share your experience, you will do so in the comment section below. Alrighty, I'll talk to you next time.